Champions here. It's Metro Melik. Thanks for tuning in to another edition of What's the Haps. We're going to get it started because we have a jam-packed fun show for you. Excuse me. Just showing that we are doing the thing, but we're 6 feet apart. Just recognizing that. Hey, Barb, how you doing? Welcome to the show.
Thank you. I'm so glad to be here.
Glad you're here. You have a wonderful place in space, and you're kind of in charge of it. Let's learn about you.
Oh, thank you.
Where are you from? What's your favorite furry animal? What's your favorite food? And what song do you jam out to when you need inspiration?
Okay.
You don't need to answer any of those questions, but let's get started.
Well, I was born at Sparrow Hospital.
Oh, cool.
I love the arts and found that passion when I was in college, believe it or not. I mean, I told you earlier I have been singing my whole life, but I didn't take visual arts classes until I went to Kalamazoo College. And I took a visual arts class, like a basic drawing class as a theater credit, and was like, I want to do this for the rest of my life.
Really?
Mm-hmm. Yeah.
So visual, like, it wasn't a high school thing? You didn't have an after-school activity to do visual arts?
No, in high school I took things like law. Well, I took drama, but as electives I remember taking law and some other very serious
Did you ever take dance?
subjects. Yes. Well, through theater I was dancing, and then I did this is kind of a funny fact, but I did a 10-month singing dancing tour in college. I took a year off to travel on a tour bus called the All-American Singers.
Really?
Yes, this is real.
Wow.
We still have pictures.
What? So they had just went all over the country and you just performed at different theaters?
We went all over the country with, basically children aged 18 to 25.
Yeah.
From all over the country, and went all over the country, mostly performing in schools. So if you remember Up With People.
Up With People.
Not dissimilar to Up With People. And
wow.
We still stay in touch with all those folks, but that was part of.
What a grand experience.
Thank you. It was. Mostly because I got to see the country on a stipend. I wasn't in a position to do that otherwise, but it was great.
How many, this isn't a test, just curious, how many states around about did you go through and or perform?
I would guess about 2/3 of the country.
Cool.
Mm-hmm. We did a tour like on the south side of the country, and then we came back kind of on the north side. So I saw a lot of those states. The only states I still haven't seen, if I'm getting it right, are Alaska, Hawaii, Washington, and Oregon.
I mean, those are kind of outliers, so yeah, that makes sense. How diverse was the group when you were touring?
Somewhat diverse geographically. Yeah. For sure. One of the guys, Chaz Langley, is in New York City proper and is famous. And, was a great friend and one of the first African-American people I've ever known, so it was he's really special.
Wait, first African-American people you'd ever known, and that was in college?
I grew up in the suburbs,
Of what?
Yeah.
You were born in Sparrow. You weren't too far from Lansing, so I'm kind of, where?
I didn't grow up in a diverse community, so that changed a lot for me in college. And Lansing, for me, coming back and choosing Lansing as my place has been a very different way of living, because I had a chance to see what the broader world was like through college, through living in Spain for some time, and then through that traveling, I was able to see and learn more than my small world in the suburbs. This was great. It was fun to come back to the area, I think 10 or 15 years later, and have a very different view of why I wanted to be here. My family's all here.
Yeah. Yeah. Wow. That's amazingly endearing and insightful. Yeah. What's your favorite song to get hyped to?
Right now, I've been listening to vintage Norah Jones in the car. I don't know if that's really hyped.
I mean, if it gets
like,
you, if it...
It's for me more about relaxing.
Like, okay.
Yes.
Which kind of makes sense. And
I have high energy.
There's a lot going on in the world. So how did you transition from theater to visual arts to basically being in the running for being in charge of a gallery? Like,
My
that
work.
probably wasn't on your radar, was it?
I've always loved galleries. Once I figured out what galleries were, that's not something I was exposed to in my childhood. I remember learning about the Chicago Institute of Arts on a trip and just being like, oh, what is this place? This is incredible. I was in high school at the time, and it really resonated with me. And revisiting those moments I still feel like they're my friends, like those Rodin sculptures at the Chicago Institute of Arts. And so I asked my professor in college, could I do this? Could I pursue this, and in what way? And for me, that's always been about arts education.
Okay.
I took all of the education coursework to be certified, and
arts education is not easy.
No.
That's so much stuff. I don't know what else. It's a cornucopia of cornucopias.
Right. My undergrad degree is in art and art history, and then I focused on education at that time. And my first job was at Pewabic Pottery in Detroit. Do you know that place? It's a historic pottery. It was founded by a woman in 1903. It's a Tudor revival style building right on Jefferson on the east side of Detroit. It's a wonderful facility if you ever want to head down that way. It's just extraordinary. And so that was my first real job out of college, and I did some of their educational programming and worked in their gallery there, and then I taught for 3 years in a private school in the heart of Detroit. I did some work in the Detroit public schools, which I loved, helped introduce students in Detroit to clay, which meant you never had any behavioral issues in those classrooms whatsoever. You'd roll in with your clay cart, and the children would just be like, what is happening? And they loved it. Kids love to get their hands in clay and have those kinds of experiences.
Yes.
So my work is about, my why, as it were, is about access. It's about access to the arts. And I think everyone deserves it. And so working for a facility where we can build strategic plans about how we help everyone feel the arts are for them and how we bring diversity, equity, and inclusion to our work, that's been such an unbelievable pleasure. It's hard work, but it's important work. And so then I worked at...
You know what I find interesting? And this is one of those implicit bias, probably goes under that umbrella, that I often think about how people in urban areas and inner city areas and then minorities may be at a disadvantage to seeing things like a gallery, an art place, or having a place like Reach Studio Art Center. Like they might not have that opportunity. But then you're telling that story as a person that was in the suburbs that didn't experience this either, being a Caucasian person. It's like the opposite of what I think it would be a person that wasn't exposed to this type of stuff. And then once you found it, how it changed your life.
It absolutely did. Part of what I try to be a champion for and what I want to fight for is that access to the arts in schools. Because if we prioritize that work and we see it as part of a whole child learning initiative, statewide and nationally, every child should have access in their schools to making, to learning, singing, performing, dancing. So it's theater, it's visual arts, it's music, and it's dance. And those are the creative outlets that make a school vibrant.
But it also turned into something where you can make it a vocation, a career, a job, more than a job, right? And being exposed to those type of things and seeing those type of things and then seeing that it's possible and then picturing yourself, whatever that individual is, in those positions to be able to make that a livelihood, a living, and otherwise is so important. It's I've been talking to people out there about mentors program, and these are the type of stories that I'm talking about. There's jobs out there that I'm learning, like I learned just a couple weeks ago, where I'm like, I didn't know that was a job. I would totally be interested in that. I had no idea that was a job. And it's these weird little nuanced things like PR, like what is PR?
Sure.
Like what is it? And now that I'm learning more, I'm like, I could have done that.
That'd be a perfect job for me.
Right, blah, 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 Melik. So the Lansing Art Gallery, when did you start being the boss?
6 years ago.
Yeah.
The gallery's, it was founded in 1965. We're 55 years old. It was founded by a handful.
Has it been in the same space?
No, 5 spaces.
Oh, okay.
And to be determined where we'll land in a more permanent way again for the future. So that's on the agenda also. Considerations for where our long-term home might lie.
So were you in Detroit when you came back to Lansing, or were you, okay.
I was teaching right in the Cultural Center. So I taught at a school that was right next to the Detroit Institute of Arts, and we took field trips. And
oh my God.
it was idyllic in many ways.
That would be so cool.
Students and families there were just incredible. So my husband and I met at Pewabic Pottery and decided to quit our jobs, get married, move from Detroit back to the Lansing area all in one summer. And I visited Lansing Art. I know. Lansing Art Gallery and Education. I was like, what is this amazing treasure? Our former director, Kathy Babcock, had posted a position that was gift shop manager. And I was like, this place is amazing. How did I live in this area and never know about this institution? So I said, this is where I want to be. And it's been quite a journey, even within those walls and beyond.
And I wish I had a better way of saying this. It's a cool space. It sounds so cliche these days, but it is, because, you go down and then it opens up and then you're like, and what another thing about it cool is that the sound changes.
That's true.
There's so many places in an urban-esque area where you go in and then that hum is still there. And it lessens so much in your space where it becomes otherworldly.
They call it a subterranean space. Our friendly architect calls it subterranean and did a piece on it. So that was fun.
Yeah.
The programs, the way we delineate the space is, you come down those stairs and then you see our retail gallery. We have one of the biggest exhibition spaces in the state in that space. I know.
It's so small.
Our exhibition space is
but
pretty significant. It's 7,200 square feet.
Really?
The front footprint, from the street looks very tiny, but it's actually a very large space. And sometimes the artwork from our artists gets dwarfed. Like when our exhibitors are planning the space and considering size and tone and color, all the different factors they would be looking at for building an exhibition, we often caution them and say, it's important that you recognize this is a very large space. The work can really it can look like a postage stamp on the wall unless you create grids or otherwise plan the work larger scale.
Interesting.
And then we have our education space.
Yes.
Which is in many ways our pride and joy, having opportunities for people to come, be in the space, witness the art, enjoy it, and then potentially make as well. So we support Michigan artists in all the work that we do, whether it's through their teaching opportunities in the education center, their selling opportunities as partners with us, or through public art where we pay them stipends.
So let's talk about public art, because with the details that are in place now, that's part of your focus, right? You sent me a list. So let's go through some of that. Where do you want to begin? Your art walk?
We're focused during COVID on outdoor and online opportunities primarily, because the physical space isn't where we're able to focus our energy. But we, based on a number of factors, including Executive Order 77, we were legally allowed back on the river trail for installation, and our artists were able to come out, and 20 artists are featured along 3.5 miles of the river trail. And that's June, July, and August. That's Art Path 2020.
So that's going to be ending soon. Oh, so get out there.
Our last artist talk is 2 weeks from now, and the staff team's excited about celebrating that. What's the date on that? Because
this is actually fast forward. So what's the date on that artist talk? Do you remember? It's
They're Tuesdays, every other.
Middle of.
Should I look it up on my phone?
Let's have them do this. They can find this information on your website, correct? And what's the website?
www.lansingartgallery.org.
LansingArtGallery.org. And you'll have information about Art Path and what the current works are on that, on the Lansing River Trail. And there's an art talk happening in conjunction with that.
5 of our artists were featured throughout the summer to share their stories.
Oh, yeah.
It's been some of my favorite things. You know, being able to go outside and social distanced. Hear our artists talk about their inspiration and the sort of the how and the why behind the work. It's really powerful.
And then you have the outdoor pop-up art sales going through October.
Yes, the Downtown Lansing Inc. and their incredible director, Kathleen Edgerly, they've been doing some really unique things. They invited us as one of the Downtown Lansing businesses to participate in the Fresh Taste of
Lift
downtown.
Up Local.
And the idea of lifting up local is something we're really excited about. So we started doing, during those weeks where they're focusing on downtown, we did basically a small art fair out front on the gallery sidewalk. We have a pop-up tent and artwork for sale. So it's been really, this is actually where I got my mask.
Oh.
By one of our local artists, Jenny Shu. And also
she's
where I
doing
purchased my
now?
earrings.
She's the bead. She's amazing.
She is. She's a fiber artist, and we've carried her work for a long time, so I've seen her work go through many iterations. She does fine art. She does fine craft in jewelry. She does sewing, stitchery. I mean, you name it.
She's one that should be famous.
Well, she kind of is. When I was at the Milwaukee Art Museum, her work was featured there.
I believe it. We have some of her work in my partner's jewelry box.
Oh, lovely.
And it's absolutely amazing. And learning more about her and her art, I learned about that art because it's one of those things when you're ignorant, you're truly ignorant. But once I started talking to her about bead work and how it worked, how the process is, and then watching, I'm like, oh, that's why that costs so much. Like, I get it.
She takes that needle and threads many beads all at once, and it becomes like a tapestry.
Yes.
A tiny little jewelry tapestry.
That's just that bead thing, let alone what she does with the big pieces and the weaving, and then she's done work in different spaces. I'm like, that's how much that costs. That's worth every penny and probably more. Right? So I was very honored to have some of the pieces that were gifted as well as some of the pieces that I was able to purchase. She's
one of our local artists that's a real shining star. You know, we show statewide, so we have Michigan artists from all across both peninsulas, but we also have some really extraordinary local talent, too.
So how do people how else can people engage with the Lansing Art Gallery at this time, which is not only health time, but a transitional time for you as well, because you're redoing the space?
Yes. Our artists, when we talked with our artists about whether they were interested in showing if we were open partially, they really felt like they wanted to push those and postpone their solo shows or their dual shows. So we're moving those into 2021, and the exhibition space is not currently open, but it means an opportunity to patch and paint the walls,
right?
You know, and to reorganize. We're doing a lot of reorganization. We're building a station for the online artwork sales. We're going to be launching online sales in the fall. So an online art gallery where if you can't come to our physical space and purchase art, you'll be able to do that virtually.
Nice.
And then that means preparation of a physical space in order to keep the inventory separate, and packing and shipping and all the other things that entails.
Well, you're so gracious in being here today and then also sharing the stage. Before we flip the subject, what would you like people to know about the Lansing Art Gallery? What's that one thing they need to know?
We're for you. You know, we're part of this community, and we have been a part of the fabric of the community for 55 years. You're welcome here is the message I feel like I often want to share with people, because galleries can be something of an intimidating factor for people. And I just feel like if we can just be, say, we're for you, that's the message I'd like to share.
And you're all very welcoming, so nobody has to worry about that.
That's
There's
the
nothing
intent.
stuffy about it. Right?
Stuffy we are not.
Right. No, well, I'm comfortable in a museum or a gallery or something like that, but sometimes when the people talk to you, you're like, whoa, you're like a caricature from a movie, and it's very,
that's
right?
true.
And
in terms of the
not
brand we want to build, it's
friendly,
about the art's
engaging,
for
opening,
everyone, and hopefully a welcoming experience for anyone who chooses to set foot inside the gallery space or now enjoy the works online. So we've captured a number of the shows digitally.
Oh, cool.
So we have a digital tour of a virtual tour of our Michigan Collegiate Art Exhibition, which was on show when the state closed.
Yes.
So you can actually go onto the website and tour around the whole space.
Awesome.
And see what that looked like, because you probably couldn't come in March
right. when all craziness
COVID hit.
Happened. All right, so we're going to change real quick because this is the let's learn as much as we can in 30 minutes or less. And there's a place not far from downtown Lansing called the Carefree Medical. And as more I learn about that, the more I realize what a wonderful space this is that serves a great need in this area.
I have personal experience with Carefree Medical. Dr. Saltzman treated my husband and me for a few years when we were without health insurance. And what an incredible human being. And the institution that he built, he passed away probably 2 years ago.
Or so,
But what a renowned and truly beneficial organization in our area.
And now there's Dr. Body, and he's carrying on the legacy and the torch. And with that, here we go. And thanks for watching. What's the Haps, Lansing? See you next time.
I'm Cindy Kangas here at Carefree Medical with Dr. Body. Hello, Dr. Body.
Hi, how are you?
I'm great. Can you tell us a little bit about the history and mission here at Carefree?
Sure. Well, Carefree Medical was founded in 2004 by a gentleman named Barry Saltman. He was a physician in Mason, and he decided to retire with his wife Suzanne, who was a nurse practitioner. And in their retirement, they thought, well, why don't we open up a clinic for maybe a half a day a week to give back to the community and take care of people who don't have insurance? Well, within 6 months of that idea, there was a line of people out the door waiting to get in because the need was so great. So they decided, you know what, we're not actually going to retire. We're going to open up Carefree full-time and turn this into our mission.
Wow. And how many people do you serve regularly?
Well, Carefree right now, we're providing 15,000 office visits per year in between our medical, dental, and optometry clinics. So we're quite busy. The need in the community is ever increasing.
And you act as a nonprofit, so tell us how people can get involved, what you need.
Well, right now with the pandemic, I think one of the biggest ways that people could help us, apart from financial donations, is cleaning supplies. In between every patient, we have to sanitize every room. We have to sanitize the waiting room multiple times per day to keep people safe, to keep ourselves and our patients safe. So if people want to donate disinfectant wipes, hand sanitizer, things like that would really be helpful during this time.
And I'm hoping also if they want to give monetary donations, they can do that as well.
Absolutely. Carefreemedical.com. There's a donate button, and we had to cancel our biggest fundraising event of the year, which was supposed to be held in May. It's called Dancing with the Local Stars, and every year that brings in at least anywhere between $50,000 to $100,000, and we had to shut it down because of the pandemic. So, like every nonprofit and every business in America, we had to retool ourselves and be creative to keep ourselves open.
If someone needs your services, how can they go through the process?
The easiest way is to call our office. The phone number for our clinic is on our website, carefreemedical.com. It's 517-887-5922.
Okay.
And that phone number is the same for our medical, dental, and optometry clinic. So if you're a person in the community who needs primary care and Either you have Medicaid or you have no insurance and you're having difficulty finding a provider, just give us a call and we will get you in. We take all comers, whether you have insurance or not. Most of our patients have Medicaid because of Obamacare, but even for the folks that don't have anything, we still see them.
Okay, can you give us a breakdown of all of the services you provide here in this building?
Sure. So there's 3 clinics underneath the Carefree umbrella. We have a medical clinic, a dental clinic, and an optometry clinic. So in the medical clinic, it's very much like your typical family medicine or primary care office. We take children from birth all the way through adults into old age and everybody in between. So if you need a physical, if you are sick and you need medical attention for your diabetes, your high blood pressure, COPD, anxiety, depression, bipolar disorder, schizophrenia. We do a ton of mental health in our medical clinic, which is a huge need in the community, especially during this pandemic. So any routine primary care we offer in our medical clinic for people with or without insurance. In our dental clinic, we do routine hygiene as well as fillings, extractions. Unfortunately, a lot of our patients went their entire adult lives without access to dental care, so some of their teeth can't be saved and they just need to be pulled. Mm-hmm. So we have days during the month called extraction days where all we do is just pull teeth.
Wow.
In order to get people's mouths healthy.
Right.
So we don't do any dentures at this time, although it's a service that we're looking to add, but any preventative dental care is what we offer in our dental clinic. And then in our optometry clinic, we offer routine eye exams. People with diabetes and high blood pressure especially should have their eyes checked at least once a year. But even individuals who think maybe they need glasses or their vision is changing over time, we can give them a routine eye exam and help them get access to glasses if they need them.
Where are you located?
So we're located in Lansing on the corner of MLK and Saginaw. It's a tall, multicolored building. It's a 6-story building. We moved in here in April 2019. Before that, we were located in South Lansing, but we grew out of that space. So moving into this building allowed us to bring all 3 of our clinics under the same roof, and it also allowed us to triple our square footage. So we can provide a lot more services to a lot more people.
Well, we appreciate you being on the show, and we also appreciate all you're doing for the Lansing community. Thank you so much.
Well, thank you so much.